right, awesome. Well, we're here live at HIMSS in Vegas and super excited. It's such an important topic. We got Danny here as well as Saleh and we got Christopher. And where do we start with this?
Yeah. Well, again, welcome to our session here. We're excited to have you, and we're excited to talk about a topic that's often overlooked, which is behavioral health, mental health, and the challenges that exist there, but also the opportunities that companies like yours are now investing in to help, address some of the issues in this in the area of behavioral health as well too. So, if you wouldn't mind just introducing yourselves first, and then let's dive into a little bit of your why, and then what your companies are doing to help provide technologies and services and solutions in the behavioral health space.
Sure.
Yes.
Solomon?
Well, thank you for having me. I'm Solome Tibebu, and I'm the founder of Behavioral Health Tech, which is the largest community focused on expanding access to mental health, addiction, and IDD services through technology, health equity, and innovation.
Great elevator pitch.
It's a little long, working
Yes,
on it.
and Danny, introduce yourself real quick.
Yeah, so Danny Gladden, I'm a licensed clinical social worker, so I'm a therapist. And I'm the general manager of behavioral health and social care for Oracle Health, a large technology provider.
Absolutely, absolutely. And we'll go back to Solomon and talk a little bit about your why. How did you get into this field? And then we'll delve a little bit later into the technologies and solutions you bring to the market.
I come into this space first and foremost as somebody with lived experience. I had really challenging anxiety as an adolescent, panic attacks, OCD, you name it. And so at the time, I was the kind of teen that was on Friday nights sitting at Barnes & Noble trying to read as much about anxiety as possible and saying, why can't all teens everywhere get access to this information? Being half Polish, half Ethiopian, we weren't really talking about mental health at home, as you can imagine. And so I started a 14 by teen online resource in 2006. I was 16. Continued that nonprofit for 10 years, and that was really my beginning into what has led to a career in all things advancing access to behavioral health through innovation, which is often technology, but not always, as you know. And now is just such a critical time for behavioral health. It's very exciting, and I'm just really committed to convening stakeholders to advance the field forward.
Wonderful. We applaud you for your efforts as well. And Danny, you and I obviously go back
We do.
a number of years
We do.
in St. Louis.
Yeah.
We both worked for a behavioral health organization
Yeah,
there.
I just love your story because, 2006, website, technology, anxiety support for teens by teens.
Absolutely.
For me, in 2010, I started providing behavioral health services via phone, video, text, and chat. And then within that time, and avatar, so think about 2010, we're sort of creating an avatar for the clinician and an avatar for the young person so that they could have a safer space, right? Also, within that same work, I was going to some of the more rural parts, remote parts of Alaska, standing up telehealth services, telebehavioral health services with, really dense technology, expensive, but all, whether was the avatar or it was sort of telehealth in remote parts of the state, it's all about using technology for access.
Exactly.
And, hey, 15 plus years later, that's still my aspiration.
Absolutely. Wonderful.
So what are you seeing areas of opportunity with collaboration? I mean, we feel really lucky, fortunate to have both of you here. Obviously, you guys are working closely together. You guys are thought leaders in this space.
How is Oracle and your company, Oracle Health, and
Yeah.
your company partnering to address this challenge?
Yeah, here's how I sort of describe it. There's two spectrums of behavioral health technology. There's likely an oversimplification, but there's still like the mainstream providers, whether I'm going to a physician clinic, I'm going to a community mental health center, or I'm inpatient or substance use treatment, et cetera, right? These are sort of have classic techniques.
Sure.
Electronic health record, a human capital management, maybe a learning management system, right? And in that area of kind of business to business technology, it's actually still pretty immature, right? So behavioral health wasn't part of meaningful use. Oracle Health as an electronic health record. We've been doing behavioral health for 15 plus years. We have some of the largest behavioral health organizations in the country and in Canada, and also some of the smallest community mental health centers. And so, that's part of it. And then on the other side, particularly on this other side of the pandemic, there's more private equity and VC money going into behavioral health than ever before, and really great innovation. And I think that's where Solome's group comes in, is convening all of those folks. And so we get these folks on, who are doing the services up to where they need to be. And as this innovation comes along, and it's really just going to change how behavioral health care is delivered.
That's great. So let's talk about this innovation. Tell us a little bit more about your technology.
Yes, plus one, Danny, you see so many providers, through your role at Oracle, and that I love that that's what you drew from it, because, since starting the newsletter years ago, I was very focused on the cutting edge. But the reality is, I too started my career at an EHR,
which we shall not name. Go ahead. Yeah.
right. Serving true nonprofits, these community mental health centers and IDD addiction, that had the trust and connection of the communities that they're looking to serve,
Exactly.
but just left out of basically, yes, my new world and the digital health ecosystem. And so through behavioral health tech, we launched last year our community behavioral health provider track, where we're really trying to serve as at least one forum to bridge the gap and to expose providers to this innovation that's happening, but also present examples of real use cases where a provider is able to get some funding to be able to pay for said innovation.
Digital therapeutics and VR and things like that.
Right. No money, no mission, right?
Right. Yeah, that's just one of several challenges to get these providers to access the cool stuff.
Absolutely.
And there's just so much potential.
Absolutely.
So to me, it sounds like there's a big movement now for non-pharmacological interventions, evidence-based, real-time access. What are you seeing here at HIMSS or in this 2025 landscape that gets you excited with this innovation?
Yeah, I think over the last 10 years, there's been I think two pivotal moments. One has been sort of the Affordable Care Act and Medicaid expansion, which expanded access.
Sure.
Two, mental health parity laws that have sort of said, hey, if you're going to provide, primary care coverage, you also have to provide mental health services. So as an industry, behavioral health looks more attractive to the folks in this room,
Right.
who historically might have said, that's another. And so you can't miss, as you go throughout this event, seeing some big names who are saying we're focusing on the behavioral health provider, the behavioral health venue, the behavioral health patient.
Exactly.
And so I just think that's wonderful. HIMSS had a pre-conference that Solome led,
Yes.
right?
That's great.
And so, yeah.
Right.
Let's talk about that.
Yes, we had a full day, very exciting. We were thrilled to showcase so many innovators, providers, advocates through this program. And yeah, there's a few things I could draw from that, but to answer your question, Michael, I'd say it was exciting to see some examples of course, AI, but in behavioral health, everything from being able to detect just through voice conversations, like is this person having some suicidal ideation?
Exactly.
Now that we wouldn't, a clinician might not have it detected on their own. To behavioral, it's been a challenge to measure for decades,
Absolutely.
and now, just in the last few years, how that space has evolved and how tech and AI is better able for providers, payers to be able to evaluate behavioral health care and delivery and feedback loops for providers now. We got to hear a few examples of that yesterday, so it was very exciting.
Yeah, if you think about AI agent as an example, and I could just speak to Oracle Health AI agent, behavioral health was carved in first generation,
Sure.
right? That might not have always been the case, right?
Right.
But Oracle Health recognizes the importance of ensuring that BH providers have the right technology. And we disproportionately really benefit, particularly from ambient note production,
Exactly.
generative AI note production. If you think about mental health, we don't have labs and x-rays. We have long form narrative
Right.
in which we are sort of, we see you for 60 minutes, we take another 30 to document. Now through note production and generative AI, I see you. I'm present with you, in about 30 seconds, 15 seconds after my session. I have a note that meets CMS requirements, that meets accreditation requirements. I am still the human, the provider in the middle. I review the note, I tweak the note,
Sure.
make sure that stuff is in there that should be and not in there that shouldn't be. But it means that, one, I don't hate my job as much.
Right. Right.
Two, because I'm not spending so much extra time documenting, I'm seeing more people.
Right.
And so I think the infusion of AI in behavioral health disproportionately positively impacts our users.
Absolutely. No, that's amazing.
Yeah, after the
Yeah.
pandemic, I do think this is one of many needed interventions to address the burnout issue.
Exactly.
Frankly.
Yep.
So I'm gonna ask, given all the excitement and all the possibilities that we see here in HIMSS around behavioral health and behavioral health technologies, what are still some of the areas of challenge that we have to overcome in this space?
Yeah. Well, I was just talking to an HIE person, right? And I mean, at the end of the day, whole person care is whole person care. If I can't treat chronic illness without helping somebody manage the depression or anxiety,
That's correct.
right? But the sort of the ecosystem still has behavioral health as another, right? And so HIEs, just as an example, often don't include the pertinent behavioral health information. Now,
Sure.
some of that was a result of regulation. 42 CFR Part 2 kind of really segmented substance use data as an example.
Right.
And so health systems were reluctant, one, to even put behavioral health in the same EHR as their, right? So
That's right.
that's changing, but I would just say data sharing is still a real problem that I think we got some work to do.
Yeah, in a similar vein, but I'd say it's been exciting these last few years to see more specialization amongst innovative companies. So as opposed to just general mild and moderate anxiety, depression type
Right.
of self-service tools, now there are solutions just condition specific,
Right.
even population specific. I myself being a teenager with obsessive compulsive disorder, I can go to an app just for that.
Exactly.
But then that means that many more siloed tools. And now it's like many payers, they have a portfolio of these things. How are they going to talk to each other? And I think that's the next
Collaboration, interoperability.
same challenge, different flavor.
Absolutely.
Exactly.
Makes sense.
Yeah.
Yesterday, one of the executive leadership summits, it was Neil, the gentleman who wrote this amazing book, and there's still so much with the data going up with suicide. I mean, it's just like, especially coming from Toronto, is where he said the data point. What can families, parents, it seems like awareness is still like the biggest thing. What could you guys share on that topic? It's with social media,
Yeah, so I got my start at a suicide crisis line, right? And so, one, I'll just put it out there, 988, 3-digit number. It's available 24/7, 365. If you call, there's a prompt for Spanish speaking. There's a prompt for GLBTQ plus. And so it's there 24/7 for anyone to access. It's the National Suicide Lifeline. The other great thing that's happening is in kind of the normal business of healthcare, suicide screening is being assessed,
Right.
right? So I go in for a broken toe, and oftentimes I'm going to be asked about thoughts of depression or thoughts of suicide. We have to normalize asking about suicide risk. There's a staggering number. It's like 50% of people who die by suicide had saw a healthcare provider within the last 90 days, right? So we have to be able to just screen and talk about it like we talk about diabetes or like we talk about heart disease, so that there's less of a stigma, so that we can make it just a part of health and care.
Yeah,
Makes sense.
beautifully said. I'd just add the young people, the statistics it's just too much. And so it's exciting to see now that there are solutions that are for adolescents that may not necessarily need consent. There are others that are focused on families and caregivers to be involved, and it's wonderful to see optionality. A lot of underserved teens, LGBTQ, adolescents of color, are utilizing tools that are not requiring consent necessarily, but ultimately being able to bring more awareness for caregivers and parents to be able to know how to have these conversations, whether it's in the workplace or elsewhere. They just need more of it because they need to be part of the solution.
No, absolutely.
Many times.
Absolutely, and I just from a personal story, my youngest son, who's 24, had two of his high school classmates just this past month commit suicide, and then 2 years before that, I attended a funeral of a good friend's son, who was a college student at the time, commit suicide as well too. So it is absolutely an epidemic, and I applaud you, both of you, for your efforts to find ways to mitigate the risk associated with this with some of our most vulnerable populations.
There's a lot of targeted effort that has to happen by population. So maybe special messages for men and boys, maybe special messages in faith-based communities. Special messages. I'm part of the LGBT plus community, right? Special messages there. It is not a kind of a broad brush approach. 988 is great, but any time we're accessing healthcare, behavioral healthcare, we want to kind of see people who look like us.
Right.
And we also want to be able to get messages that make sense for our life.
Exactly.
And so I think probably more of that has to happen.
Oh,
Yeah.
So during the pandemic, when I wasn't organizing behavioral health tech, I was running a fund for Pivotal Ventures, which is Melinda French Gates' personal investment office, focused on youth mental health. We funded 100 organizations nationwide during the pandemic that had a special focus on LGBTQ adolescents as well as adolescents of color. And oftentimes, the providers that we're funding were not at all what you would call a traditional clinic or provider. It's a community-based organization that gained the trust, just as you said, that it's not traditional healthcare at all.
Absolutely. Well, we could talk about this subject for the next hour or two, I'm sure. If someone wanted to reach you and find out more about the programs that are happening within your two organizations, how would you make that happen?
Yeah, thank you. For behavioral health tech, add me on LinkedIn. If you do, you might not
Right.
And of course, save the dates for our event, November 11th through 13th in San Diego, brings together our key event.
Absolutely.
Yeah, on LinkedIn, Danny Gladden, danny.gladden at oracle.com, and oracle.com as a website. We appreciate this opportunity.
No, thank you.
Yeah.
Both. Happy to have you.
Michael, thank you so much. Christopher, good to see you, sir. Yeah.